Hello and welcome to our health channel. Here, we'll be exploring a variety of topics aimed at promoting overall well-being. From nutritional tips to fitness insights and mental health advice, our goal is to provide you with valuable information to support a healthier lifestyle. So, let's embark on this journey together towards a happier and healthier you. Cut down on trans fats to keep your heart healthy. Here's a simple guide to help you do that. Trans fats are linked to various health issues, especially an increased chance of heart disease. It's essential to understand how to decrease your intake of trans fats. Our foods consist of different elements, some beneficial for health, while others might be contributing to health issues. Trans fats fall into the latter category. They are created by adding hydrogen to liquid vegetable oils through a process called hydrogenation, solidifying the fat. This method produces trans fats, which enhance the shelf life and stability of food products. However, they have been associated with several health problems, including heart diseases. Consuming dishes rich in trans fats can elevate the risk of heart disease, emphasizing the importance of reducing their intake. Here's a guide on how to achieve that. Understanding trans fat. Trans fat is an artificial type of fat created through a process called hydrogenation, where hydrogen is added to liquid oils. This process changes the structure of the fat, making it more solid at room temperature. Impact of trans fat on health. Trans fat is associated with various health risks, such as heart disease. Trans fats increase the risk of heart disease by raising bad cholesterol, LDL, levels. Inflammation. Consumption of trans fats can lead to increased inflammation in the body. Good cholesterol, HDL, reduction. Trans fats may lower good cholesterol, HDL, levels. Artery health. They contribute to the buildup of plaque in arteries, restricting blood flow. Stroke risk. Higher trans fat intake is associated with an increased risk of strokes. Insulin resistance. Trans fats may contribute to insulin resistance, leading to type 2 diabetes risk. Weight gain. Some studies suggest a connection between trans fats and weight gain. Cell function. Trans fats negatively affect cell function and can impact overall cellular health. Mental health. There is emerging evidence linking trans fat intake to an increased risk of depression. Cancer risk. While the evidence is not conclusive, some studies suggest a potential link between trans fats and certain cancers. Reducing trans fat intake is advisable for maintaining overall health and preventing various chronic conditions. Minimizing trans fat consumption, a guide. Despite the elevated risk of heart disease and mortality associated with consuming trans fats, a January 2023 report from the WHO reveals that 5 billion people worldwide still include them in their diets. It's crucial to take steps to minimize trans fat intake for better health. Here's what you can do. Select oils that are good for your health. Pick oils that are good for you, like olive oil, canola oil, or sunflower oil, when you cook. An expert says these oils are rich in good fats, mono and polyunsaturated fats, that provide important fatty acids. These fatty acids can lower inflammation and enhance brain function. Healthy oils also have antioxidants that protect your cells. Using these oils can make you feel fuller and reduce your appetite, which is helpful for managing your weight. Check the information on food labels. When you look at food labels, focus on the total fat part. Look for words like partially hydrogenated oils, because that can mean there are trans fats. Choose products with very little or no trans fat. Cut down on eating processed foods. Eat less processed and packaged foods since they can sneak in trans fats. Examples include margarines, frozen dinners, and prepackaged snacks. Whenever you can, go for whole, unprocessed foods. They're often healthier and less likely to have hidden trans fats. Prepare your meals at home. Cook your own meals at home using fresh ingredients. This way, you have more control over the fats you use in cooking. Making your own meals allows you to pick whole, unprocessed ingredients, which means you avoid the hidden trans fats often found in fast food and packaged items. Using natural fats in your home cooking is good for your health and helps cut down on the unhealthy trans fats you might consume. Choose natural fats. Some natural trans fats are in small amounts in nuts and avocados. It's better for your heart to use these oils instead of the partly hydrogenated oils often in processed foods. Natural fats can be good for you if you eat them in moderation and as part of a balanced diet. They provide important fatty acids, help keep your cells healthy, and assist in absorbing vitamins A, D, E, and K. Pick alternatives that are free of trans fats. Look for snacks and baked goods that don't have trans fats. Some options include plain popcorn, not too oily or buttery, fresh fruits, Greek yogurt, or fat-free yogurt. Choose baked goods like low-fat cakes, muffins, and cookies. Are trans fats present in all packaged foods? Not every packaged food has trans fats, but it's important to check labels, says the expert. Words like partially hydrogenated oils, shortening, and hydrogenated on the label suggest there might be trans fats. Being mindful of the fats we eat is an important part of having a heart-healthy and balanced diet. The guide, Minimizing Trans Fat Consumption, offers practical advice on reducing the intake of artificial trans fats. It recommends choosing healthier cooking oils, reading food labels to avoid trans fats, preparing meals at home with fresh ingredients, and opting for natural fats in nuts and avocados. The guide emphasizes the health risks associated with trans fats, particularly the increased risk of heart disease, and encourages informed choices for a healthier diet. Thanks for watching. I appreciate your time and interest in our health journey.